Hello, my name is Jacob Thyssen. I'm a professor of dermatology working at Bispebjerg Hospital in Copenhagen in Denmark. It's my great pleasure to share with you some of the very limited insight that we have in the epidemiology and burden of facial involvement of atopic dermatitis. Here are my disclosures. And here are 3 photos of patients that I have had the great pleasure of helping over the years. And as you can see here, facial atopic dermatitis is something that can involve both very young patients and older patients. You have the fiery erythema in the young female, then you have the more edematous atopic dermatitis with scratch marks in the young man, and then in the older patient on the right, you can see how chronic inflammation really translates into a continuous attempt of the skin barrier to limit water loss by cell division, and there you get the very thickened skin, also called hyperkeratosis. Now, these 3 individuals all share the same problem, that is, their atopic dermatitis is very visible. It may be painful, it may be itchy, and they are, of course, affected by this in their daily lives. Other patients have more of a neck involvement. I think this typically is something we observe in females. We have this unfortunate term called dirty neck because it tends to have a more brownish appearance in some individuals. I think it's unfortunate, but it illustrates some of the impression that it gives of people who are looking at the skin of affected individuals. Now, unfortunately, very little research has been conducted so far to investigate the burden of facial AD or head and neck AD. Now, one recent study that was published, sponsored by Eli Lilly, is really a great contribution to atopic dermatitis research. Now here, by examining and surveying 599 adults with atopic dermatitis, this study illustrated that the most bothersome areas in patients with atopic dermatitis are the head and neck, as well as the hand and fingers. And also, in an association analysis, it was very clear that patients with face and neck, as well as hand and finger involvement, had more anxiety and depression as measured by the EQ-5D scale. In a study that we conducted in Denmark, where we surveyed 4,000 adults with atopic dermatitis, all seen for their disease in the hospital system. Now, we asked them about their desire to have either almost complete skin clearance or complete skin clearance. These are the terms used in the IGA scale, which is widely used and FDA approved to measure efficacy or severity of atopic dermatitis. And in our data analysis, we could show that there was a significant association between reporting face and neck AD and then having a desire to obtain almost complete skin clearance or complete skin clearance, again emphasizing or at least supporting that there is a particularly burden of facial AD or head and neck AD. But how common is this? What proportion of our atopic dermatitis patients are affected by facial AD or head and neck AD? Well, based on a systematic review and meta-analysis led by Jonathan Silverberg's group, we could see that about 42% of all AD patients have facial AD or head and neck AD. And when we try to stratify by the region, we can see that in Southeast Asia, the proportion was lower. And perhaps this is a true thing. At least in one of the next slides, you will see that the same was found in a recent survey of adult atopic dermatitis patients. Now we want to understand more about some of the characteristics that are associated with head and neck AD. And here, if we go back to some of the data we got from the survey of 4,000 adults with AD in Denmark, we could see that with increasing severity, there was an association with head and neck involvement, here indicated by the burgundy arrows. If we then move on to a very recent survey, which was published in the EADV, we can see here among almost 1,300 adults with atopic dermatitis, facial AD was very common and did not depend on gender, to a small degree on ethnicity. Again, here we see the slightly lower prevalence in Asian individuals. Was not really dependent on age of onset, perhaps some higher proportion in those with childhood onset. And then we see that in older individuals, there tend to be a lower prevalence here in those more than 60 years of age. Now, the big question is really, why is facial AD so common? Well, we don't have a definite answer, but we have some speculations that I think are worthwhile of reflecting about. So here we have a skin barrier which is worse than any other parts of the body, perhaps except for the dorsal aspects of the hands. Now we know this from studies in adults where the water loss measurements are much higher on cheek skin compared to forearm skin, chest skin, and back skin. In a recent study from the Irish group led by Alan Irvine, we could see that the natural moisturizing factor, that is the degradation product of filaggrin, really is lower on the cheeks and reaches steady state much later than for other aspects of the skin. Now we know from immunology that once you have had inflammation, resident T cells can readily be activated later, and therefore we often see inflammation at the same sites. And then remember that facial skin is really always exposed to temperature changes, to changes in ambient humidity, to UV exposure, and also to pollen and some of the air pollutants that are very common in big cities today. So here's a picture of a pigeon, and then you may ask, why does he include a pigeon in his talk? Well, the reason for this is that if you look at the capacity of the pigeon to synthesize vitamin D, it's 30 times elevated on the toes compared to under the feathers. And I mean, that makes such good sense because this is where you have the UV exposure. Now, I submit that the reason why we have low natural moisturizing factor levels on cheek skin and on dorsal aspects, hands, is really because we needed to generate more vitamin D. And I'll try to go back to explore more on that. But first, if we try to look at the prevalence of filaggrin gene mutations, they are much more common in northerners, meaning that in equator near country, it's about 0% who have a filaggrin mutation. Then we have 1% in Greece, 2% in Italy, 4% in France, and then 10-12% when we reach the very Nordic Scandinavian countries. And interestingly, if you try to compare the latitude with the level of vitamin D in general populations and the prevalence of filaggrin mutations, you can see a nice correlation. Of course, this is not evidence, but there might have been an evolutionary benefit of filaggrin mutations because those who went north developed these. And what would be meaningful? Well, what we could see is that filaggrin mutation carriers have 10% more vitamin D in their circulation compared to non-mutation carriers. This was a stronger difference if we look at those who have homozygous mutation, meaning 2 alleles affected, and when we measure these in the summer. And this is based on 5 clinical cohorts, a general population cohort from the north, Denmark and Germany. To round it off, I wanna take it a notch further. So not only did filaggrin mutations become common in northerners to increase survival from the benefits of vitamin D, but also these exposed sites, the hands and the face, where we know that the vitamin D capacity, synthesis capacity is 30-fold increased in a pigeon, they also 8-fold increased in humans. And therefore, I submit that we have further filaggrin degradation or lower quantities in these aspects of the skin in order to increase survival. And with that, I'd like to go to my concluding slide, which is really that atopic dermatitis in the head and neck area is common, and in particular in those with filaggrin mutation, severe disease, childhood onset, and young age. We know that AD in the facial area negatively impacts quality of life. And I think that it's clear from our study that those who have head and neck area involvement specifically ask for resolution of their AD. And perhaps this is really the modern prize of evolutionary benefit in the past. Now, thank you for listening to my presentation, and I hope you will have a wonderful virtual symposium.